My laboratory studies graft versus host disease, or GVHD, which is a deadly complication of bone marrow transplantation. Patients with gastrointestinal GVHD often have the most severe form of the disease, and up to 50% of them may die. My colleagues and I created the Mount Sinai Acute GVHD International Consortium, or MAGIC, to study this deadly complication. There are over 20 centers around the globe, and in this study, we studied almost 150 patients from centers in the United States and Germany. We found that an antimicrobial protein called regenerative 3 alpha, or REG3, that's made in the GI tract increases in the bloodstream of patients who have gastrointestinal GVHD. In a surprising paradox, the specialized cells that make REG3 are actually destroyed as its serum concentration increases. We studied this paradox in several mouse models of graft versus host disease. In a GI biopsy from a mouse without graft versus host disease, REG3, shown in brown, is abundantly expressed in almost all of the cells of the epithelium. But in a biopsy from a mouse with graft versus host disease, the REG3 expression is very dim and hardly expressed at all. Further studies show that this protein helps gastrointestinal cells grow under sterile culture conditions in vitro. Thus, we have discovered an entirely new function for this antimicrobial protein of the innate immune system. It actually helps intestinal stem cells to thrive. So now, when a patient has GVHD, the only medicines that are effective suppress the immune system. They're called immunosuppressants. So in some autoimmune diseases like inflammatory bowel disease, we know that the intestinal stem cells are also affected. So this now suggests that there's an entirely new strategy of helping those patients to repair their GI tracts.